All right, welcome back to Daybreak. It's now 28 minutes past 7 o'clock. I almost said 32 minutes to 8 o'clock, but it's the same. For the last 3 months, the country has been battling an invisible enemy, the coronavirus pandemic that has so far claimed the lives of 103 people in Kenya. But the effects of the pandemic has been felt more by those that have not tested positive but have had their lives disrupted, jobs lost and the future uncertain. Nyeri County is one of the 37 that have reported cases of infection and one fatality. Our reporter Martin Munene has been monitoring the COVID-19 situation in Nyeri County and tells us of more diseases that could be of more worry than the pandemic, while also illustrating the costly nature of the pandemic to the economies of residents of Nyeri.
Of the over 3,594 coronavirus cases in the country, Nyeri County has registered a total of 9 COVID-19 infections.
3 of the positive cases are healthcare workers who contracted the virus during the normal course of duty. This is a great sacrifice to our people, and I want to recognize them for their devotion and commitment to duty.
Of all annual deaths in Nyeri County, almost half are linked to non-communicable diseases.
Nyeri is one of the high-burden counties for NCDs, with close to half of deaths in the county caused by non-communicable diseases, and about 700 new cancer cases annually.
Persons with pre-existing conditions have been termed by health experts as high-risk individuals should they be exposed to the virus. Majority of the 100 COVID-19 deaths in the country are persons that had other comorbidities.
And I want to urge the people of Nyeri to continue working together with the county government so that this figure does not rise. And this applies to residents in other counties as well.
On Wednesday last week, county governors were instructed during a summit meeting with President Uhuru Kenyatta to establish at least 300 beds per county to equip such facilities to take care of COVID-19 patients. Governor Kahiga has the task of lifting the current capacity 10 times.
Level 6 will also be part of ourselves and of that journey. We are looking at the possibility of broadening our outlook towards our hospitals, our teacher training colleges, so that we are able to beat COVID-19. What we want to ask for is closer networking between ourselves, my people at the Department of Health, and the people at the Ministry of Health and Kenyatta National Hospital.
The Nyeri economy, however, has been adversely affected by the pandemic and containment measures taken in the county. From small-scale traders who depend on wares from Nairobi to matatu operators who have had to change routes or close a shop since the cessation of movement into and out of Nairobi, business is no longer usual. For many here, living with COVID-19 is proving too costly. Its reality more worrying. Some feel the precaution has been catastrophic for their livelihoods as they look forward to further relaxation of measures come early July. While at it, the coronavirus pandemic and its infection rate remains a strain as many strive to keep up with expensive measures of masks, hand washing, sanitizers, and social distancing that would appear unnatural. Residents of Nyeri County and Central Region being urged to be more vigilant as the region has high numbers of non-communicable diseases, a situation that could worsen cases of COVID-19 in the region. Martin Munene, Citizen TV, Othaya Hospital, Nyeri County.
All right, that is Martin Munene reporting to us about the situation in the county. Of course, you see how much of an impact the coronavirus pandemic has had on residents of that county. But now to speak to us this morning is the governor of Nyeri, that is Mutahi Kahiga. Good morning, Governor.
Good morning to you. How are you?
I'm all right, and thank you so much for joining us on Daybreak this morning. And let's begin with a question, because yesterday we heard you say that so far you have 30 beds that would take care of COVID-19 patients. And one wonders, why are they so low? Or is it as that think this is low? What has been the challenge in getting more and more as the situation would require?
Thank you very much. What I said is that we have currently 30, the isolation center, that is Mount Kenya Hospital, has 30 beds, which we are raising to 50. But then we are also spreading out. Because we've been in talks with CS Mutahi Kagwe, and one of the focus was on Othaya Othaya Level 6 Hospital. We felt that it was not right for us to be doing more than, doing the same thing, yet we are focused on the same agenda. And I do remember that last week he brought in about 35 beds to that facility. It has a capacity of about 300. And so we are working towards ensuring that one has the requisite number of 300. But then we also have a total bed capacity of 1,018 in this county, distributed in my hospitals. The level 5 has about 367. We have the next big one is Karatina, which has 260. Mukurweini has 170. Othaya level 4 has 77 beds. So I have beds within the facility, within my facilities. But as of now, remember, we were yet to be hit hard by this pandemic. And with only 9 cases, we still felt that Mount Kenya was perfectly capable. However, we have the following areas that we are preparing to look into. That is Kagumo Teacher Training College, which has a capacity of 540 beds. We also have Kamwenja Teacher Training College, which has 240, and we are going to work towards preparing the places, and they'll be ready for use in the event of a spike.
Okay, and from my count, based on the figures that I just provided, 540 plus 240 would be 780. I'm just wondering, what do you need to do to these beds to make them conducive for patients? Is it just a mattress and some bedding, or do you need to install them with some more facilities?
No, maybe it is also good to say that, we have no cure for COVID. And what we are doing is that COVID patients are just being isolated. Remember, we are even looking at the possibility of home care for those that are asymptomatic. But those that have exhibited really serious signs, though we have, I think we have only had one, we will be focusing more on getting ventilators. And so far, the county has the total capacity of ventilators in Nyeri County today is 19. Which are distributed within the facilities. Mount Kenya has, our PGH has about 7. We have 1 in Mount Kenya. In the event we need more, we can just transfer the same. We have our private hospitals that also look into this. Othaya Hospital, the level 6 now has another 7 of them.